Autism spectrum disorder is a complex condition to be understood. As the name suggests, autism spectrum disorder is a spectrum disorder where someone could be very mild on one end of the spectrum while there could be quite severe individuals and would be on the other end of the spectrum. ASD is a behavioral diagnosis and not a pathological one, meaning there are no biological tests that confirms an autism spectrum disorder diagnosis. The diagnosis is entirely based on exhibiting behavioral signs. And this also means that there is a high probability that someone who suspects their child of being on the spectrum could be completely wrong or incorrect in the diagnosis. As a parent, it is recommended to follow your gut and read as much as possible to understand what this means. Be honest to yourself, and if you feel there is something not right, jump onto it so that you do not lose time. The sooner you start working on this, the better is the outcome. In this video, we will cover everything that you needed to know about autism. This video is brought to you by Good Health Corner. At Good Health Corner, we bring research health information in a simplified manner that is easy to understand. If you like what you see here, we request you to support us by clicking the like, subscribe and the bell button. This will ensure that you get notified every time we release a video. Disclaimer: the health statements made in this video and the site are not intended to diagnose, treat, or cure or prevent any disease. They are solely for informational purposes. Always consult your doctor before implementing any treatment protocol. Let's start with the behavioral patterns associated with autism spectrum disorder. Over the years, behavioral psychologists have shortlisted certain behavioral patterns linked to being on the spectrum. And these are largely categorized as impairments in social interaction, speech, sensory regulation, and cognition and behavior. Let us dive into these individually to understand what this means. Social interaction. Though it is normal and intuitive for kids to make friends and communicate, it might not be easy for someone on the spectrum. They can have extraordinary talents in areas that could be much more complex, but simple things like making friends and being in a group might not be their forte. Normally, they would seem to be shy and prefer to be alone. It's a world that they create for themselves, where they're most comfortable and choose to be in it. And for a child, this could mean that he prefers to play alone than with his friends in school, or is mostly by himself throughout the day. Kids by nature are curious and discover newer things every day as they grow and share them with their parents. For example, picking up a leaf or a flower from the garden and bringing it to their parents to show what they got. This might not be the same in the case of a child on the autism spectrum. They might appear to be indifferent to others and might not seek parents' comfort. In many cases, they are sensitive to touch and physical contact, which leads to this social distancing. This could be heartbreaking for parents, but it is important to understand that your child is not doing this deliberately. They need help, and they do not have anyone apart from you to help them come out of this world. Another thing that is incredibly difficult for individuals on the spectrum is to have sustained eye contact. And eye contact plays a role in non-verbal communication, giving cues to people on what you like or dislike, or interests or non-interests. Having sustained eye contact is key to trust building and sustaining a relationship, and the absence of which creates an invisible wall in building social interaction. A few signs of impaired social behavior would be poor eye contact, not responding when their names are called, or not sharing toys to play in a group. Speech impairment. Speech is one of the most important factors for a growing child, and in autism, this could be impaired at various levels. One of the biggest challenges of a person with autism is to make themselves understood by others. Many of them have delayed speech or unusual speech patterns. There are many individuals on the spectrum who cannot express themselves properly by stringing words together into sentences and sentences together in having a meaningful conversation. Scripting is something that we find very common here. Scripting means memorizing scripts from movies or videos and repeating them word for word. You can also have echolalia, which means repeating the exact word which you hear. Speech is expressive language, and it comes after you have receptive language, which is the ability to understand words and languages. Receptive language needs to develop first, for speech and communication to develop later. This does not mean that speech cannot develop after a certain age. There are many interventions possible to target speech, and in many cases, kids have overcome this barrier and have overtaken their peers. Sensory issues. Sensory management is something all people on the spectrum have to deal with in varying intensities. Sensory issues can be classified as being hyper, meaning oversensitive, or hypo, meaning underresponsive. Depending on which senses are playing, hyper or hypo, an individual can have a daily struggle managing these. Hypersensitivity to sound can manifest itself as closing ears with the hands or resistance to malls and crowded places that could be noisy. Similar sensory overload can occur for kids with hypersensitivity with lights, color, and sights. Using noise cancellation headphones and special glasses help these individuals to manage the overloads. Sensory issues also play a huge part in diets, and many of these kids are picky eaters. Picky eating comes mostly from not liking the texture of the food. On the other hand, you will have kids who like to chew on their shirts, which is also a sensory-seeking behavior. Hyposensitivities are also equally common. Many of these kids have a very high pain threshold, meaning they have a low sensitivity to pain. Getting hurt, which normally causes unbearable pain, seems to be okay with some of these kids, almost like superhumans. But this is an issue that needs to be addressed by consulting a good occupational therapist working on special needs. There are many ways in which sensory issues could be addressed. Occupational therapy is a great way in which you can address sensory integration. Working with different textures, colors, and lights help the mind slowly calm and accept this over time. Speech therapy is another great way by which you can address sensory issues related to mouth, chewing, and food. That's why getting a good speech therapist is important for supporting speech and also sensory processing related to food and helps with jaw strength and chewing. Cognition. When we talk of cognition, the first thing that comes to mind is imaginary play. And most of these kids, they lack imaginary play. Imaginary play is when you see an object, you understand the use and play with it appropriately. For example, a kid playing with the dad's phone as if he's having a conversation with his grandparent on the other side of the line. This is a classic example of imaginary play. For kids on the spectrum lacking this would mean play with the phone in unusual manners and not as it is intended to be. Other examples of cognition will be being aware of the surrounding, aware of danger, etc. For example, the understanding of jumping off from a height can cause injury. Imaginary play is natural to kids, and if this is found to be missing, should be a red flag. Appropriate play with toys is another example. A neurotypical kid would appropriately play with a car, using it for racing or bumping to other cars as if in a race or mocking an accident, etc. If the same car is presented to a kid on the spectrum, spinning the wheels will be what he'll do in all probabilities. Cognition comes from observing and learning from our daily experiences. And if the mind is too busy or noisy to observe the world, our learning will be slow and will show as poor cognition. It has been shown in many types of research that cognition could be directly linked with what we eat. And poor eating habits can lead to food intolerances and inflammation in the brain, leading to confusion and impacting cognition. Many have seen remarkable improvements in cognition by making simple changes in food habits. As a simple rule, try to avoid sugar, gluten, and casein, and these are known to be inflammatory in nature. Behavior. Certain behaviors are characteristic of being on the spectrum. Attention deficit disorder and attention deficit hyperactive disorder. These are milder forms of autism spectrum disorder where the person faces difficulties in attention span coupled with hyperactive behavior. A good example will be the inability to concentrate on studies and complete a chapter, or always restless and unable to focus. Self-stimulatory behavior, also known as stimming. This behavior is extremely common among all, be it kids on the spectrum or neurotypicals. But in the case of autism spectrum disorder, this may be amplified to the point that it consumes the person the entire day. We all have stimming behaviors, like tapping a pen on the table or pacing up and down during a tense situation. We do this as it helps us to calm down and helps in managing anxiety. And it affects the kids on the spectrum the same way, helping calming down and releasing tension. But in the kids' case, you will find spinning wheels, opening and closing of cupboards, fidgeting with pens as stimming behaviors. These are harmless behaviors as long as they are under check and do not affect other learning activities. Obsessive compulsive behavior. This is also a classic behavior seen among these kids. For example, cars or cans lined up and getting upset if anyone moves them. There could be other OCD like a demand for sameness. For instance, going to school via the same route every day, same morning rituals, etc. There are different ways this could be addressed. Through applied behavioral therapy, a more acceptable behavior is taught to them. It works and needs to be one of the therapies in your arsenal in addition to speech and occupational therapy. There are other therapies that work in different ways than applied behavioral analysis, but at the same time are extremely effective. You may want to check out the Sunrise program, which is great, and many have benefited from it immensely. So the question is that where to start? To start with, you will need to know exactly where your kid stands on the spectrum. You can use the link provided in the description of the video below on the Autism Research Institute and do a quick assessment called ATEC. ATEC stands for Autism Treatment Evaluation Checklist. As per the ARI site, this tool is not a diagnostic checklist. It provides several subscale scores and a total score to be used for comparison at a later date. The lower the score, the fewer the problems. The ATEC was developed in the mid-1990s as a tool to understand if treatment protocols are bringing any clinical improvements in these kids. It covers 77 questions in broadly 4 categories: speech and language communication, sociability, sensory and cognitive awareness, and physical health and behavior. You will need to do this periodically to keep a track of the progress. And we would recommend you to do this once a month to start with. To sum up, we hope that this video provides you with some guidance on what to look for and where to start. Doing the ATEC will give you a good idea of where you stand as of now. Always remember, the only thing that stands between you and your child's recovery is a window of opportunity. No matter what age your child is, there are always good possibilities of recovery and leading a meaningful life. Hope you have enjoyed this video. If you'd like to see more such videos, we recommend you to subscribe to our channel and give a thumbs up to this. A little bit of encouragement from you will go a long way for us. Thank you, and we hope to see you again. Bye for now.